Hi, today is Wednesday, April 10th, 2019, and you are tuning into part 2 of latest research on stopping the progression of pulmonary fibrosis. And if you watched part 1 and you're here for part 2, I thank you very much for following through. I believe right now is around 6:30 p.m. I did part 1 8:30 this morning. So when I say I believe, I'm literally jogging my memory as to what I spoke about in part 1. But I do earnestly believe that I discussed, the basic symptoms of pulmonary fibrosis, what the fatality prognosis is, and why you might consider an alternative therapy to the prescription drugs that are currently on the market, the latest drugs as of 2017 that are being marketed to ease the symptoms of pulmonary fibrosis that are currently linked to the development of liver disease and severe bleeding disorder. So those two things are, pretty solid reasons for wanting to try an alternative therapy. Now, the title of the study that I'm going to review with you is Effects of Feiwei Granules in the Treatment of Idiopathic Pulmonary Fibrosis, a Randomized and Placebo-Controlled Trial. All right, so I am not quite sure why they would call this a placebo-controlled trial. This is a Chinese clinical research. The study was conducted in China. It's actually published in the Journal of Traditional Chinese Medicine. But neither of the protocols that were administered to the study participants could be considered placebo. I'm going to break down the title for you real quick. So this is studying the effects of Feiwei granules. So the first thing I looked up there was Feiwei. Where do you buy Feiwei granules, and with continual searching, what I found is that Feiwei is actually a Chinese diagnosis of a holistic problem. So if you go to a Chinese doctor, I don't know what you would call that, TCM doctor, traditional Chinese medicine doctor, they don't just look at your one symptom. So they're not going to just look at your pulmonary fibrosis and just treat that as a lung problem. They're going to look at all of your organs and see, where you may be deficient in other areas. And that is how they came up with this concept of Feiwei, F-E-I-W-E-I. And what I found was that people who have Feiwei syndrome also have kidney deficiency and some other deficiencies. Something called weak qi, which they consider an energy force that is not studied at all in Western medicine. So in order to even know if you have Feiwei per se, you would have to go to see a TCM doctor and get diagnosed that way. What these doctors saw was that a lot of people who have pulmonary fibrosis have Feiwei syndrome. So they had devised a separate compound of medications, Chinese herbal medications that they called Feiwei Granules. What I'm going to do after this post to YouTube is, in the comment section, I'm going to highlight what is in, or maybe the summary. I'm going to highlight what Feiwei granules are comprised of. And if you're interested, you can go see a TCM doctor yourself, and you'll actually know. You can say, well, this is how this was treated, and it worked so well for these people who had pulmonary fibrosis, along with these other problems of blood stasis. That means your blood is stagnant, your circulatory system is compromised and stuff like that. And they also had kidney deficiency, but that was the only word that was used. Kidney deficiency, I don't know how how it was deficient. Okay, so the effects of Feiwei granules in the treatment of idiopathic pulmonary fibrosis. Idiopathic pulmonary fibrosis. So that means these people did not have incidents of pneumonia or bronchitis or chronic obstructive pulmonary disease or any of those things that could have contributed to scar tissue developing in the lungs. Their diagnosis of pulmonary fibrosis is considered idiopathic, meaning the etiology is unknown. No one knows why they developed that disease. Okay? So these are the people who were recruited to the study. And the reason for that is because it has been found that the disease, pulmonary fibrosis, is more aggressive and rapidly progressive in people who have idiopathic pulmonary fibrosis. That's the people who had a precluding infection, and those people normally have acute exacerbations. They get breathing treatment, they jump right back into life. Whereas people who have idiopathic pulmonary fibrosis unfortunately deteriorate much faster. Okay, and this is a randomized and placebo-controlled trial. Randomized is pretty straightforward. That means we get a certain X number of participants. In this case, there were 100 people that enrolled, and by a luck of the draw, 80 of those participants were given the Feiwei granules, because that's what's considered the experimental treatment. But they say it's placebo-controlled, and the other, in the United States, what we consider a placebo is something that does not have an effect on the condition itself. But that's not the case here. The 20 other people were actually given something referred to in traditional Chinese medicine as Jin Shui Bao capsules. That's JINSHUIBAO capsules. And those capsules are basically what I want to talk about today. Those capsules contain Cordyceps sinensis, and that is not at all a placebo. It is very therapeutic. They were given, each group was given the medications over a period of 9 months. They were observed for 6 months afterwards. Okay, and both medications were found to be very, very helpful. So if you feel like your diagnosis of pulmonary fibrosis may be accompanied by a kidney deficiency, a slowing down in the chi, maybe you're of Eastern descent and you know what that really means, by all means, go find a TCM doctor and get a workup. Maybe this treatment methodology with the Feiwei granules is exactly what you need to bounce back, because it was found to be an excellent treatment for people with that Feiwei disorder. But both treatments were helpful in as far as restoring pulmonary function. Okay, that means they were able to breathe normally at the end of the 9 months. They were able to complete the 6-minute walking test without losing breath. They also were administered questionnaires, the Medical Research Council dyspnea scale, dyspnea, referring to shortness of breath, to see if it worsened or got better. And it got better for both sets of participants, those who were taking the Feiwei granules and those who were just taking the Jin Shui Bao or the Cordyceps sinensis. So I'm not going to prolong this too much. What I'm going to share with you, however, is the actual schedule. So all of the study participants, whether they were on the Feiwei capsule arm or they were on the Cordyceps sinensis arm, all of them received prednisone breathing treatments. So that's promising. If you are getting breathing treatments, you don't have to wonder and say, oh, should I take this? Is it safe? It is safe. You can do that. And the way the Cordyceps sinensis was administered was a person of average weight 150 pounds was given 40 milligrams of Cordyceps sinensis 4 times a day for 1 month. Then in the second month, they were given it 30 milligrams 4 times a day. By the third month, down to 20 milligrams 4 times a day. And then for months 4 through 9, 10 milligrams of it 4 times per day. I went to print the results, okay? And the print came out really, really small. You see, it's not even taking up the entire page. But I didn't have time because I was running out from work. So you're going to see me reading like this. I don't care if you laugh at me. That's okay. But I just want to share this information with you. So the main component of the JCs, the Zheng Shunan capsules, is powdered Cordyceps fungus. It benefits the lungs and kidneys by securing essence and tonifying qi. It can be used in the TCM, traditional Chinese medicine syndromes of lung kidney deficiency, absence of qi, chronic cough with asthma, fatigue, sleeplessness and forgetfulness, weakness in the waist and knees, irregular menstruation, impotence, and premature ejaculation. So those are the things that it is normally prescribed for. Several studies have shown that the main active ingredients of Cordyceps sinensis are D-mannitol and polysaccharide, as well as other amino acids, nucleotides, sugar alcohols, sterols, peptides, vitamins, inorganic elements, and polyamines that are essential for humans. Those compounds can regulate immune function, antioxidation actions, and anti-tumor actions, inhibit the inflammatory response, regulate blood lipids, promote tissue repair, adjust immune functions, relax bronchial smooth muscle, regulate metabolism, and resist pulmonary fibrosis. Okay? And then it refers to the bibliography. Zhou et al. Demonstrated that Cordyceps sinensis liquid can improve the early alveolitis seen in pulmonary fibrosis. Yang et al. Found that Cordyceps micellar powder can inhibit excess deposition of collagen fibers. Yang et al. Treated rats with pulmonary fibrosis with Cordyceps micellar powder and found that it could improve gas exchange, relieve infiltration of inflammatory cells, and suppress and prevent pulmonary fibrosis. JCs are used widely to treat idiopathic pulmonary fibrosis. Okay, in the present study, after consulting experts in respiratory disease, researchers used JCs combined with prednisone as the control group. They found that the efficacy of FGs, which was the Feiwei Granules, were similar to that of JCs, the Cordyceps sinensis. Okay, FGs improved various indices after administration and were found to be superior in the event of idiopathic pulmonary fibrosis to simply using Cordyceps sinensis. Serious treatment-related adverse events were not observed. Okay, so that you should find helpful. Cordyceps sinensis is something that you can find on the Amazon marketplace, which is a huge marketplace for just about everything. I told you how much to take per 150-pound body weight. And of course, if you have questions, leave comments. My email is provencures@gmail.com. And thank you for watching. Have a good day. Oh, and subscribe. I always forget to say this. Please do me a favor. Subscribe to Proven Cures and share my videos. Thank you. Bye-bye.